My name is Michael Cross. As you know, I'm with the Miracle Brace, and the reason for my visit with you today, I wanted to talk about Course in Miracle Brace. And could you tell me about your credentials?
I'm an orthopedic surgeon in practice roughly about 28 years or so. Specialize in arthroscopic surgery of the shoulder, hip, and knee. And a lot of that involves pre-op evaluation, post-op evaluation, monitoring of rehabilitation.
You've obviously have the credentials, and you participated in the consultancy, the design of the Miracle Brace. Would you mind going into some of the aspects of the design and why the Miracle Brace is better than other braces on the market?
Well, I think number one, it's very comfortable. A lot of times a brace is only effective as much as the patient wants to wear it.
Yeah.
And so I found that the Miracle Brace is quite comfortable. It can be worn for extended periods of time. And the bottom line is it's effective.
In your professional opinion, what types of injuries would be best served by the Miracle Brace?
So I think that the role for it is in patients who, after a significant injury or after a surgery, develop a flexion contracture where they can't fully extend or straighten their knee. And that becomes a functional problem if it's left to become permanent. So there is a chance, a window of opportunity to correct that if someone runs into that problem, and that would be the role for the Miracle Brace.
I know that insurance companies don't like to pay for, two braces. One, limits motion, and then this, of course, is a straightener, an immobilizer. But, let's say, you're Magic Johnson, you got a knee injury, so money is no problem with that patient. Would you want to get him in the Miracle Brace at some point, even for a brief period of time? For a severe knee injury?
It depends on if they develop a problem with losing their extension.
So to the layperson out there, is this device the best to use after a knee injury, and why?
Again, only if they are running into a problem after extension, getting an extension, okay, either after an injury or in a period of time after surgery. That surgery could be a ligament surgery, or it could be a replacement surgery, or it could be a post-traumatic surgery.
Okay. All right. So based on, what would you tell, sports teams, pro sports, college level, as far as keeping this on hand? Would you advise that sports teams keep one or two of these on hand? If so, why? If not, why not?
I think it's a good tool to have. It's currently not available. It is unique, so it's not been utilized, nothing like it's been utilized in a training room. But again, if you can jump on people who lose extension after surgery, they do better.
And there was a testimonial, this is somebody that used a Miracle Brace, and I'd like to get your thoughts on this testimonial about this person's experience. It was obviously a very severe case, how the Miracle Brace made significant progress in only 1 week, and to what you attribute their rather immediate results after using this device when other devices had failed, and even physical therapy was not creating lasting results. And here is his testimony of his experience with the Miracle Brace. After my surgery, I had no quadricep function and my patella was frozen in place. My leg wouldn't straighten. I faithfully followed my doctor's orders, including wearing an uncomfortable brace. I made almost no progress. I started physical therapy, and what little progress I made each visit would regress before the next visit, which I find that's fairly common. Eventually, I quit going. I tried the Miracle Brace, and after several hours, my patella was freed up. Within days, my quadricep function returned. I made more progress in 1 week with the Miracle Brace than 6 months of traditional therapy. And to what do you attribute the qualities of the Miracle Brace? Why was this patient able to see such quick results?
I'm not quite sure.
Okay.
But I do know, after 20, 30 years of experience, that the body heals with scar tissue, and that scar tissue is a friend if it helps facilitate healing, but it can be a foe if it gets in the way of healing and functional recovery. So there are a certain minority of patients that fit that category for whatever reason, and those are the patients that benefit from it. Now, this patient in particular was highly motivated. He did everything that was supposed to be done, and he still had problems that he couldn't get ahead of. And no matter, it was quite frustrating. Nothing I said or his physical therapist said helped, but this did.
He was an avid basketball player.
Yeah, whether or not this was, and quite an active individual. So, so I think there, whether it's a coincidence or it's due to the brace, who knows? But I've also seen that repeated subsequently.
So for the instances where an ACL, MCL, or MPFL or knee replacement surgery occurs, in your opinion, do you see advantages to utilizing this device? And we've touched on this a little bit earlier, pre-op and immediately after surgery for the most effective rehabilitation and recovery.
So I would say in the vast majority of cases it's not needed either before surgery or after surgery, but there are a certain minority of patients who do run into this problem, and it limits their progress, and it's very frustrating. So for those patients, I think the clinician needs to be kind of clued into what the problem is and what's available, and getting the word out that this may be a game changer is important.
So you've seen what other devices can and cannot do. What are the major advantages of the Miracle Brace compared to other devices currently available?
Again, I think the big thing is comfort.
Okay.
It's very, very padded. It's very comfortable. It's very gentle, slow, steady pressure. The other devices are just not as effective. Head to head, I think there's probably a difference to be made.
One of the things, of course, about the Miracle Brace is that you can put an extreme amount of pressure on the joint indirectly, not to conflict with the knee directly, the sutures, things like that, and it's still comfortable.
Correct.
I mean, okay.
That's correct. That's what I found.
And I mean, and I'm the layperson, but that to me seems to be head and shoulders the main advantage over other braces.
Yes, I agree.
And we've kind of touched a bit on this, and this is the last question, and then you can share any comments that you'd like to. But we've talked about comfort while utilizing any durable medical equipment device. And how important is comfort in a patient's recovery?
Well, one of the potential problems we run into as providers is patient compliance. So again, if the patient doesn't want to wear a brace, it's not going to do any good. But if they find that it's comfortable and if they see results, then it would increase compliance.
Mm-hmm. Mm-hmm. Anything else you want to add about?
Well, I think it's been several years in the making, and I've looked at and tried on various iterations and prototypes, and I think the final product reflects that.
Okay.
So I think there's been a pretty good thought process into developing it.
Well, again, thank you for your time.
Sure.
Appreciate you taking the time.
Sure.
All right. Thanks, Dr.